Good evening, Carbon County. Thank you for joining us this evening. Tonight we have a little bit different take on our traditional provider workshops that we normally do each month. Instead of a provider, we are hosting Ken Harman, CEO of Memorial Hospital of Carbon County, and he's going to be sharing a number of the exciting updates that are taking place within our organization, as well as healthcare throughout Carbon County. So with that, welcome, Ken.
Thank you very much. I appreciate the opportunity to be here. And we certainly appreciate the chance to visit with you and answer any questions that you might have as well. Memorial Hospital of Carbon County and our board have been very focused on our mission, which is really to improve the health of the individuals who reside within Carbon County. As an organization, over the last couple of years, we've put together a strategic plan that are really focused on a couple of different areas. Number one, which is really improving the clinical quality and the engagement that we have with our patients. And secondly, was really looking at the level of care that we have and making sure that we can provide the care in the locations where folks are living. Third area is really looking at some of the future growth opportunities that we hope to be able, because this year we're celebrating 100 years as a hospital, and we hope to be able to be here for another 100 years. And so I'll just touch base on a couple of the things that we currently are doing and have been doing to affect some of those changes. First, maybe I'll talk just a little bit about some of the quality and service experience improvements that we've made. In the hospital, we've been looking at orthopedic services, and there's a lot of individuals in Carbon County who are in pain and have need to get out of that pain. We had wonderful physicians flying in who were providing great care, but a lot of our individuals within Carbon County either had to wait for services or they were going elsewhere to get those services. So we've now been able to recruit a wonderful orthopedic surgeon who's double fellowship trained. He's trained in joint replacement, and he's also trained as a trauma surgeon. And he was actually teaching at the faculty at the University of Colorado. We've convinced him to move up to Rollins. And starting next week, he will be full-time in Rollins, taking care of each other here. So there's no need to drive. We will have an exceptional physician, Dr. Andrew Jonason. We're excited to be able to have him. He adds to the already existing complement of providers that we have. We have Dr. Darren Allred, who is a fellowship-trained orthopedic surgeon who comes to us out of Salt Lake. And he specializes in a lot of sports injuries, orthopedic shoulder injuries, but is also very good as a generalist as well. And they join Bob Kill, who is a physician assistant, to really help round out our orthopedic program. In addition to that orthopedic program, part of our musculoskeletal orthopedic growth efforts is really looking also at pain management. And we have a wonderful group that coordinates and works to help bring that in. So a lot of the quality that we've been doing is looking at how can we better take care of folks so they don't have to leave. And orthopedics was one of the areas where there's been some very recent changes. In addition, we continue to do a lot of things in terms of the clinic. In Rollins, we've added 2 wonderful providers this year. Dr. Lincoln Westfall joined us in January, and Amanda Jones, who is a physician assistant, joined us just this last month. And these 2 physicians added to our already wonderful providers of Patty Shue and Jen Waggy and Dr. Mike Sell and Carrie Lake and Peggy Lake and Chris Williams. By having this group of wonderful providers, we're able to be able to take care of the needs of individuals here in Rollins. So if you have need for family care services, we want to make sure that you have people that you can come to, develop relationships with, and be seen for years. For me, healthcare is about relationships and it's about location. People should not have to drive we should be able to provide those services where they live. So related to that, we're in the process right now of doing a complete remodel to the Hannah Clinic. And so MHCC Family Practice Hannah will have a grand reopening on July 30th, so just next week. We have gone through, we put a new heating air conditioning system with proper HEPA filter systems. We put new flooring in, new countertops, new paint, both inside and out, to really refresh that. In addition, it's really working with the wonderful providers there. We have Carrie Lake and Peggy Lake and Dr. Johnson, who just do an absolutely wonderful job of taking care of patients. Just last month, we were able to open up the Saratoga Clinic. Dr. Chris Williams has been seeing patients out there for about 6 months, but opening up the clinic out there in the Platte Valley gives us the opportunity to better take care of individuals and to be able to provide choice to individuals. Dr. Williams is an absolutely wonderful physician. That's who I choose to personally go to, so I drive out to Saratoga when I need to get my medical care, and he's just doing a great job. But when we talk about our mission statement is about improving and focusing on improving the health of the Carbon County residents. Not all of what we're doing at Memorial Hospital is things that we have to own. We're partnering with other groups and other individuals to accomplish that purpose as well. Most recently, last month, we signed a contract to provide support for the Medicine Bow Rural Health District. They have a clinic in Medicine Bow with Catherine out there, and they provide very good services for the patients in Medicine Bow. But they needed some help, and the hospital was willing to step in. We're providing medical direction, so Dr. Chris Williams is reviewing the charts and providing support as a physician for a wonderful nurse practitioner who's out there. As administrative, I go out to their board meetings. I was out there last night, and we had the opportunity to do a review and make some recommendations to that clinic of things that they can do to continue to improve. They have a rich history of providing great care in the community, and our partnership with them will now assist them in being able to continue to meet that care and hopefully even increase the level of care. We're having conversations with other independent clinics around the area as well, and hope to be able to announce some more partnerships to help other clinics to be able to improve care within Carbon County and adjacent areas soon. But it's not just the primary care clinics. We're looking at and have partnered with Fremont Therapy. So when you think of physical therapy services, Fremont Therapy has done a wonderful job and has a great reputation. Memorial Hospital had a wonderful physical therapy program as well. But we had two programs that were standing up here and competing against each other. And all that does is it drives the cost up, and it decreases the efficiency and the effectiveness of clinics. So we sat down with the owners of Fremont Therapy and said, how can we work together? How can we partner to decrease the costs for Carbon County and improve services? As a result, we closed down our physical therapy program. We bought some interest in Fremont, so we jointly own the clinic there, and we're working together to provide better services. We're excited that we're opening up that clinic out in Saratoga as well. So physical therapy services and rehab services are now available through Fremont Therapy in the Platte Valley and in Rawlins. And so partnership is a large part of what we're trying to do to be able to grow and meet the services. And so over the last year, we've spent a fair amount of money, but more importantly, spent a lot of time and energy looking at how can we take care of people where they're living. And so right now we talked about the primary care growth in those clinics. But the exciting thing is over the next 90 days, we're going to start having some specialist services in those clinics. And so you're going to see in Hannah, you're going to see in Medicine Bow, you're going to see in Saratoga specialist services. So individuals don't have to drive to Rawlins, or they don't have to drive to Laramie or Casper or other places. They can get those primary care services and those basic specialty services here at home. We believe it's important to support Carbon County. We're trying to do that. And the same thing we're asking the Carbon County residents, if we can make your needs met and we can do it with high quality and low cost, we think that we're able to, really accomplish that mission, which is improving the healthcare services. In addition to those clinics and specialty services, we've been looking at recently a lot of information and had a lot of concern about what's happening with mental health and suicide. Unfortunately, the state of Wyoming has the highest suicide rate in the nation. Carbon County, unfortunately, has a lot of suicide attempts and unfortunately some successful suicides. We believe that Memorial Hospital of Carbon County plays a role in helping come up with solutions in partnership with schools and with churches and with the local governments and with the other wonderful providers that are here. Carbon County has some things that we're putting in place to try to assist in this process. The hospital's done two things. The first thing we did is we looked at kind of the urgent and emergent issues that are showing up in the emergency room and in the hospital. What can we do to provide better care? And so we've contracted with a group called CLEAR. It's a national organization that has psychiatrists. So we have 6 psychiatrists on the hospital staff now who are able to zoom in on telemedicine and provide support for our ER physicians, or to provide support for our hospital-based doctors, to be able to do better assessments and to provide better suggestions of how we can take care of individuals who are going through some mental health things. We've noticed that by doing this, we're able to better manage individuals who are in this crisis. Sometimes we're able to get them out to outpatient services. Sometimes they need inpatient care. But by having CLEAR and by spending the money to help grow this service, we think that we're really doing a lot. Over the last 2 months, as a board and as a medical staff and as the management team, we talked a lot about suicide because we've seen some suicides occur in this community, and we felt that we needed to do something even more. So Memorial Hospital of Carbon County is excited to let you know that we've now hired a counselor. That counselor, Joanne Reintz, is working out of our family practice clinic here in Rawlins and is able to hopefully provide some support for individuals so they don't reach that crisis point. So if you or any of your family members are dealing with some stress and anxiety and you need just a little bit of help, feel free to call the clinic and get a time to visit with Joanne. Or go to one of the other wonderful clinics that provide mental health support here in town. There are 3 other clinics that do wonderful service as well. We just want people to get help. So in our primary care clinics, we've not only developed specialists to be able to provide that care. In our clinics, we're starting to do some depression screening so that we can help and refer people before they get in crisis. So these are just a few of the things we're doing in terms of the counseling and mental health. We hope that in the next 3 to 6 months that we're going to be able to expand some of those services to be able to not just be in Rawlins, but to be throughout Carbon County. And so we're looking at expansion of that counselor so that we can maybe have another counselor over in the Platte Valley or in Hanna or in other areas in the county. And so as we think about improving health, the hospital has focused a lot of energy on improving services within the hospital. I touched on just one, which was orthopedics. We've done a lot of work on expanding services in the clinics so that we can provide services exactly where people are at, whether that be in the Platte Valley, whether that be in Medicine Bow or Hanna, or whether that be here in Rawlins. And we hope in the future to be able to have conversations about how can we help the folks in Bags and other parts of the community. In fact, we've already reached out and are having some very preliminary conversations with some of those folks and letting them know that when they come up for bid, we would be honored to be able to talk about what that community needs and how we might be able to help them, or how we might be able to partner with them or others in providing that service. And then most recently, obviously, the work that we're doing on the mental health. I'm just going to kind of segue into some other significant improvements, because the improvements that I've been talking about the last little bit are really about patient care. But we realized that Memorial Hospital of Carbon County had some need to make improvements in areas that weren't just patient care. When I was interviewing here and I checked references, and when I got here, one of the biggest problems that Memorial Hospital of Carbon County had was in the billing. People complained that sometimes the bills never went out, or if they did go out, sometimes they didn't go out correctly, or someone would not get a bill until they were sent to collections. I'm very proud to say that we have worked really hard over this last 18 months and made dramatic changes. The billing process is about 95% completely cleaned up. We are exceeding national standards now in terms of the timeliness and the accuracy of the bills. I've got a process in that we're looking at every single day. How many claims are created, the accuracy of those claims. We call it the clean claim rate. Our objective is every single claim, if we can have it go out clean, that makes it to where as patients and as users of the service that you'll be able to have an accurate bill. And so we're making progress. There's still a little bit of room to go there, but I am really, really proud to say that the processes we have are as good or better than any other hospital in the state right now, and we're proud of that. There's some continued efforts that we're looking at right now. We're looking at, are there ways for us to help individuals who have large self-pay balances? Maybe they don't have insurance, or they have insurance but they have a really high deductible, and when they come into the emergency room now they have a couple $1,000 bill. And so we're working with some local banks and with some other organizations, and we hope in the next 90 to 120 days to be able to announce a program to be able to have some assistance and some better loan support to help individuals be able to manage those expenses. So lots of positive things occurring on the billing process and with the billing cycle. In addition, we're looking at our computer programs. The hospital right now has about 8 different computer programs that we use in different parts of the hospital. We have an electronic health record for all the patient information for the inpatient. We have a separate system in the emergency room. We have a completely different system in the clinics and in multiple other areas of the department. Sometimes those computer programs talk to each other well, and sometimes they don't. As we've talked to the board and we talked about the importance of being able to do everything we can to improve the clinical care and the quality that's offered, we thought it was important to go to one longitudinal record, so that everything that when you come into the emergency room, the doctor already has everything that they'd have in the clinic. They'd have everything from your previous hospital stays. They'd have all of your labs. They'd have all of your imaging studies. And so we just last month selected Cerner, which is a wonderful computer system. In fact, most of the government hospitals in the VA and in the Department of Defense use Cerner. It's one of the larger systems out there, but it gives us the ability to have best practice computer systems in the hospital. We will be building and going through an implementation stage for the next 9 to 10 months on that. And this next summer, in May and June, we will go live and have one single computer system. It's a significant investment in terms of time. It's a significant investment in terms of resources, but it's something that we believe is important to be able to make sure that we are able to take care of people in a really top-notch manner, and to be able to have our providers have all of the information on the patient in front of them so they can get the complete picture and be able to provide even better care. Now, we've talked about the computer system, we've talked about the clinical care, we've talked a little bit about mental health. As an organization, we've also had a lot of conversation with the county commissioners and with our board about what do we need to do as a hospital to ensure that we're here for the next 50 years. One of the things we're really looking at is how do we look at creating the facility to take care of that. We are now in the stages of doing a master facility plan. What that means is we're evaluating what the cost would be and what the process would be for us to build a new hospital. We will be doing that process for the next 6 months. At the end of that 6 months, at the end of December and at the January board meeting, we'll have an opportunity to sit down with the board and talk about these are the type of things that we need to have in order to be able to build the new facility. This is the kind of square footage that we think it's roughly going to be. This is what the cost elements would be. This is how we can finance it and all of those kind of things. And as we go through that analysis, then the board will have some facts that we can make some determinations about what kind of time frame do we want to go with in terms of getting architects and contractors involved to design and build. But we have to have that foundation work done first in terms of what can we afford and what does the community really need going forward. But the board is committed and the county commissioners have asked us to really look at, in a quick time frame, what can we do to build a new hospital here to take care of the community for a long time. Now, all of the things we talk about, these are all exciting growth things. Opportunities to improve clinical quality, opportunities to expand services, opportunities to buy new health records, and potentially to build a new hospital. How are we paying for all of that? Because a lot of people out there hear that we're Memorial Hospital of Carbon County, and they make the assumption that Carbon County obviously is being, financed and run on the basis of taxes. I'm very proud to say we are not receiving taxes. The county commissioners have not given us tax money. All of the expansion that we've done, building the clinic in Platte Valley, the remodel in Hanna, the expansion in orthopedics, the new computer system, all of that we have funded through the revenue that we've generated through operations. We're being very careful stewards of the money that we're able to make, and we're trying to make sure that we put that money back into investing to accomplish the mission, which is improving health of Carbon County residents. So how do we plan on building a new hospital? We're not going to be going to the taxpayers. We're not going to be asking for additional dollars. If we're going to be able to afford to do it, we should be able to afford to do that out of the revenue that we make. If we can't do that, then we shouldn't build it. We believe that we have an accountability to be fiscally responsible, and we believe we have an accountability to try to take care of the county. As a taxpayer here in Carbon County, I don't want to pay new taxes. I want to make sure that we have excellent top quality health care available for us, and I want to make sure that we're here in 50 years so that my children and grandchildren are able to get care, that my wife and I are able to get care, and that we're able to provide care to you. So those are just a few of the things that I thought maybe we could talk about. With that, maybe I'll answer some questions or I can go into further detail on any of that.
Okay, we'll start with a couple of questions. You mentioned improvements in the clean bill rate. Would you describe other measures that the hospital uses to determine quality and patient satisfaction? Absolutely.
So we've created an entire quality committee at the hospital. We have physicians on it, we have nurses on it, we have business folks on it, and we have every single department in the hospital has come up with 1 or 2 or 3 measures of things that we can do to improve quality. Now, some of those are related to clinical quality measures, and so we look at what our national best practice. So as an example, if someone's having a heart attack in the emergency room, there's a certain amount of time that you have to make sure that you get aspirin on board or that you get an EKG run. You want to make sure that if it is in fact a heart attack, that you get them onto a cath lab table within a certain amount of time so that you can take care of it. If someone's having a stroke, there's certain medicines. And so we measure and track all of these clinical measures in terms of clinical best practice. And any time that we're not meeting those standards, which to be honest, most of them we're meeting or exceeding the national standards, but on the few that we aren't, we're putting together action plans to be able to make those improvements, and we're reporting back on those. Some of the quality measures are what I'm calling customer service, because healthcare is not simply about a doctor providing the care, it's also about the compassion that you have, and that's patient engagement. We've partnered with 2 organizations. One organization is J.L. Morgan, which is a firm out of the southern United States. And the other is we have a consulting firm who's helping us look at our Google ratings and other things. So we ask our patients, what has been your experience? It's all confidential. It goes into those organizations. They then provide the results to us, and we make changes. I'll give you an example. In the first quarter of 2021, we were looking at our inpatient stay, and a number of our patients said that the discharge process was a little confusing. I remember when I was discharged a couple of years ago from a hospital stay, I was so tired, I just wanted to go home. The doctor and the nurses came and told me everything, but by the time I got home, I think I forgot half of what they told me. Thankfully, I had my wife with me who captured most of it. But our patients during the first quarter of 2021 said that it was a little confusing and they didn't understand every aspect of it. So we sat down and had 5 nurses that work up in ICU, work in med-surg, and we said, okay, we've got to do something different. They changed some of our processes. We've been getting survey results now in from J.L. Morgan from this patient satisfaction, and I'm proud to say that we're now in the top 10% of all hospitals in the country at providing understandable discharge instructions, something we weren't really good at prior to that. But because we asked the questions, we sought the feedback from the community members and the patients that were here, we're able to make changes. In addition, I'll tell you another thing is we have a patient advisory council. We've got a group of women who reside in Carbon County that we meet with, and we ask them questions about what could we be doing differently. A large part of the focus has been really on women's services and OB services. That women's group has been involved in our interview processes. They're helping us select the physicians that are here. They were involved in interviewing Dr. Jennifer Motley. If you've not met Dr. Motley, you need to. She is an absolute joy. She has the most contagious laugh of anyone I've ever heard. Just fun to be around. But her clinical care is just exceptional. Great, great obstetrician who will take care of women. But we have this group of women in the community help us to be able to select the person that's going to be able to take care of them. They've also given us some advice on how we can change some of our processes. And over the next 60, 90 days, you're going to hear some significant major announcements about different things that we're going to be doing in women's services to provide better care for the women of Carbon County. So we're looking at, in terms of clinical care, some of those national practice things. We're looking at how do we treat with compassion and making sure that the patients feel that the service was good, and how do we engage with the community to get their advice even though some of them aren't patients. So we're doing those things. And we're looking at business processes. So we're looking at clean claim rates. We're looking at how many days cash on hand we have to make sure that we've got reserves built in so that we can withstand problems. Much like we had last year with COVID. Much like we had last year with the floods that shut down the hospital for a month. You have to build the financial reserves so that we're here to take care of people when you have the need. So hopefully that answered the questions.
Yes, thank you. Would you talk a bit about how MHCC is meeting the needs of our Spanish-speaking population?
Absolutely. You know, we've got a lot of wonderful individuals who reside in this community. And in Carbon County, we have a large Hispanic-speaking population. And as an organization, we sat and we had a conversation about that and said, how are we doing? So we've done 2 or 3 things in the last year to dramatically change how we're responding. The first thing we did is we went through and put a number of our employees through a certified medical transcription language process. So we now have certified translators, so that we have individuals when you come into the hospital who can help make sure that the doctor understands what's going on. We've always had a language line so we can pick up and get someone on the phone. But for me, and I think for most people, if you have someone in front of you, it's a whole lot better. So that was the first step we did. The second thing we looked at, and we talked to a number of our Hispanic speaking members of the community, and they said, we want providers, and we don't want to have translated, we want to talk to them directly. So we've gone through, and the last 2 providers that we've recruited are Spanish-speaking providers. Dr. Westfall that we talked about that started in January, and Dr. Amanda Jones, who is the physician assistant, those two individuals are fluent in Spanish. And we're able to have our Spanish-speaking patients go in and talk to and receive care from a provider who understands their language and can converse with them. The third thing that we're very close to starting is we're going to have a phone number for Spanish patients so they can call and talk to a scheduler at the clinic who speaks Spanish. And they'll be able to then go in and see the Spanish-speaking provider. They don't have to worry about it. We take care of all people who are here in Carbon County. We love and appreciate the great work that the members of this community do, and the Hispanic as one large segment of that population. We're honored to be able to take care of. So those are just a few of the things. There's a lot of other things that we're working. You'll see us down at a booth down at Latino Fair on August 14th. If you want to come down and visit with us, we'll have the doctors down there. They'll be able to talk to you and share a little bit more about their personal experiences and things as well. But we really want you to know we care about the Hispanic population, and it's something that we're really striving to make changes on. So, thank you.
Would you talk about COVID visitors restrictions within the hospital and clinics, since it's been a while since we've talked about anything related to COVID pertaining to the hospital? So would you touch on that, please?
Absolutely. So I'll talk just a little bit about COVID. Obviously, COVID hit us last year and the beginning of this year very, very hard. Unfortunately, we've had some wonderful individuals in Carbon County who've passed away. We continue to have a lot of residents of Carbon County come down ill with COVID. It breaks my heart. I've seen individuals personally, I know of individuals personally who were healthy, didn't have a lot of comorbidities, and I've seen some very bad sickness. I've seen some death. And the reason I say it breaks my heart is, to be honest, COVID is a very preventable disease. If individuals would consider getting the COVID vaccination, while there's risks and while there's side effects, and while we respect everyone's right to make those choices, it makes a difference. 99% of the hospitalizations that are occurring in the United States right now, and including Carbon County, are individuals who have not been vaccinated. Individuals who've been vaccinated, only 1% of all hospitalizations in the country are from those individuals. Most importantly, probably the best reason to get vaccinated is, one, you protect yourself, obviously, but the second thing is you protect others around you. I was proud to be, I think, the third person in Carbon County to get vaccinated, behind Dr. Abels and Jackie Wells from the Public Health. I think we had about 150 people that first day who got it. Every member of my family have been vaccinated, including my 14-year-old son. The reason we did this is because we care about Carbon County, we care about the community, and we want to be able to get past this. Right now we're seeing the Delta variant start to spread. The vast majority of the cases that are populating here in Carbon County and through the state of Wyoming right now is the Delta variant. We're going to be doing a Facebook Live next week where we'll have the medical experts, Dr. Abels and Dr. Johnson, and some other providers that will be able to share some information about that. If you have not received the vaccine, I guess I'm imploring you to please consider. It makes a difference. The last 2 weeks we've seen a lot of children getting sick at the Boys and Girls Clubs and other places. These are individuals who aren't eligible to get the vaccine. If we as adults would have had it, those kids may not have gotten sick. We need to be able to have better vaccines. This is not a liberal thing. This is not a conservative thing. This is a medical thing. So call me at the hospital if you've got any questions. Dr. Abels or myself or Christina Ball would be happy to talk to you and provide you some of the studies and the facts, but it makes a difference. As a hospital, we take the focus really seriously of having a safe environment to take care of patients and have a safe environment for our staff. And so as a result, we're following the federal government CMS requirements and recommendations and the CDC guidelines, which says that individuals who come into the facility, particularly if you're in a patient care area, have to wear a mask. And if you're coming in, we need to make sure that we're providing those protections. And so what we did is we came up with a very scientific-based process that's based on the county positivity rate. If the county positivity rate is below 5%, we're what we're calling green status. If we're between 5 and 10%, we're in yellow status, and if we're above 10%, we're in red. Last week and the week before that, because of this recent surge of the Delta variant, we were in yellow. Thankfully, we're starting to see a little bit of that come down, and so this week we're back to green status. Each of those statuses, green, yellow, and red, provide different protections for our patients and for our staff. Red means we're pretty much limiting to very few visitors. We make a few exceptions in end of life. There's obviously some exceptions for parents if they're coming with a child who's a minor, but very few exceptions. Green, we're opening it up, and we have opportunity to have 2 visitors come in to see patients. And we've kind of created a process that's logical, and every single Monday and Tuesday we're looking at the statistics from the state, and we're publishing that within our organization, and we change every Tuesday based on what's happened that last week in the county. So going forward, from today through next Monday, we're in the green status, and I hope that continues. But there are a couple of clusters right now that are a little worrisome, so we'll have to see. I think that answered a lot more than the visitor policy, but COVID's real. Wait until you talk to someone who's died, or has a family member who's died, like I have. It's hard. Wait until you talk to someone who got sent home from work and had to sit down there for 14 days because they weren't vaccinated. And had they been vaccinated, they could have been back at work, burning through their vacation time, burning through their sick time and PTO. It's sad because we're going to lead to more burnout in terms of our community because they're not going to be able to take vacations because they'll have used it all up sitting being quarantined. Most of the hospital staff have been vaccinated. We're leading the state as a hospital. We've got almost 75% of our staff who have been vaccinated. Right now, unfortunately, in Harman County, we only have about 34% of the total population who have been fully vaccinated. I think we're close to 50% who've been partially vaccinated. But the protections for ourselves and the protections for others really becoming fully vaccinated. So if you haven't got the shot, please consider it. If you got the first and haven't yet got the second, please consider it.
All right, thank you. All right, so I think last question. You've described some of the ways that MHCC is working to enhance patient engagement and the patient experience. Would you touch on some of the ways that MHCC is also working to enhance community engagement and be involved within the communities of Harman County?
Absolutely. If you were to look at the hospital strategic plan, I've talked about a couple of the, what I'm going to say, pillars or focus areas: clinical quality, patient engagement, financial stewardship and strength, and growth, and how do we meet those needs. The fifth area that we're really focused on is we believe we have a responsibility to make Harman County a better place to live for us and for you. And so the hospital has been very involved. We do a lot of things that we've partnered with the school district on, both Harman County 1 and Harman County 2. We've done a lot of free physicals. You're seeing us go out to the schools and do physicals. We've asked for donations, and every penny of those donations that have come in, we then give back to Harman County 1 and Harman County 2 to help them pay for the activities that our students are participating in, that our children are participating in. we work very closely with the Fair Board, and we're involved in providing free screening. So when you come out to the fair this year and you want to get your blood pressure checked, we'll be able to do that for you. When you come out to the fair and you've got a mole or something you're worried about and says, is this skin cancer? Stop by. We'll be happy to do that analysis for you. We're going to be talking about nutrition. We're going to be doing really fun visits of our mobile clinic so you can see the mobile clinic that enables us to get out and to do some of those things. We've gone out into parts of Carbon County and done some of these screenings with that mobile clinic, and we're going to be able to continue to do that. We're also really trying to get involved in some of the economic development and business organizations. Stephanie sits on a number of boards. I'm going to be on a number of different boards to be able to try to make sure that we're invested in making sure that Carbon County is better. Those are just a few of the things. There's a lot of work that we're doing in supporting a lot of great organizations out there as well. We are so pleased to be a partner with the county in the public health. We work really hard with Amanda, who is the Carbon County Director, now Dr. Abel, who is the medical director for public health. We do a lot of work with that. We're doing a lot of education. So some of it's around healthcare. A lot of it's just around making Carbon County better. So if you have kids in 4-H, we've got a wonderful program that we're working with a number of partners. So it's not just us, but it's partners that we're working with and having a day at the fair for kids. We're having some luncheons to honor the 4-H children who just are doing a tremendous amount of work and doing a lot of effort. And so we believe it's our responsibility to make this community better. So those are just a few of the things.
Thank you. So at this time, it does not look like we have any further questions. As always, for the viewers, if you do think of something after the fact that you would like to ask of Mr. Harman or any of our administration team, please feel free to send a message through the hospital Facebook page, and we will return with an answer as quickly as possible. Thank you for joining us this evening, and thank you, Mr. Harman, for speaking with us.
Absolutely. Just on behalf of MHCC, thank you for tuning in and listening to us. You have a lot of things that you could be doing, particularly on a beautiful night tonight. We care about Carbon County. We feel blessed and honored to be allowed to serve you. So thank you very much for the trust you place in us. And we make a promise to you that we're going to do everything in our power to continue to be here to take care of you when you have that crisis. So thank you for the trust.